Hello, it's Dr. Rhonda Johnson, and today is Friday, February 19th, 2021. And today I'm going to be talking about blood clots as a complication of COVID-19 infection. We call this in medicine abnormal blood clotting. Another term is hypercoagulability. That is something that has happen a lot in people who have COVID-19. Now, why this happens is incompletely understood. The experts have a name for it. They call it thromboinflammation or COVID-associated or COVID-19-associated coagulopathy. But what we know about this, and again, I want to say that I'm not an expert, the SARS-CoV-2 virus can directly invade and attack the blood vessels lining the cells. They're called endothelial cells. This creates endothelial injury, which sets up a complex activation of inflammation and other sequences, which ultimately leads to small and large blood clots within the cell and cell death. Folks, when your cells die, when enough of them die, then your organs will fail. And if they don't recover, then that causes serious complications. And sometimes this activates other processes in our body that can lead to a fatal state that doctors call compensated disseminated intravascular coagulation, which is never good news. The bottom line is that COVID-19 can result in an increased risk of blood clots. Now, there are two types of blood clots seen with COVID-19. Blood clots in the vein, that's called deep venous thrombosis. And you remember that the veins are the vessels that bring the blood from the body back to the heart for oxygenation. Now, again, the spectrum of blood clotting in COVID-19 can be very broad, and it can vary widely among different people. Just like the features of COVID-19, it can range from a mild cold or asymptomatic infection to various degrees of organ dysfunction or even death. So with COVID-19, you can have what's called venous thromboembolism. That's blood clots in the veins. That can include deep venous thrombosis, what's called DVTs. Most people think about that as blood clots in their legs or their arms. Pulmonary embolism, which is a very severe and life-threatening complication when blood clots dislodge and go into the lungs. Now, this venous thromboembolism, this clotting of the veins, is real common in patients who are hospitalized and in the ICU. And it appears to be more common in hospitalized men who have a high prevalence of obesity and other chronic medical conditions such as heart disease, high blood pressure, and diabetes. Now, sadly, COVID-relating blood clotting is just not limited to the veins, but it can even occur in the arteries, the blood system that carries fresh blood from the heart to the body. We've seen strokes, and it appears that young people are more at risk for strokes from COVID. And you can have blood clots in the arteries that are leading to the brain. Again, we've seen this a lot in previously young and healthy people who have developed COVID-19 strokes. It can cause blood clots to the limbs. And sometimes it's mild and sometimes it's severe. People with COVID have had to have amputations of their feet, toes, lower limbs, and fingers. There is a well-recognized syndrome called COVID toe, where small blood clots can become lodged in tiny blood vessels in the toes. There's also been blood clots to the kidneys, and again, I talked about blood clots to the brain and the lungs. So again, COVID-19 can cause this hypercoagulable state where the blood clots quickly. It can be due to injury from the lining of the blood vessels. It's markedly increased in hospitalized patients and in men. But it can happen in people who are thought to have recovered from COVID-19. So I just want to spend a minute making sure that people know the signs and symptoms of blood clots in their legs and their arms. These would be the deep venous thrombosis. You can have swelling. You can have a change in your color. You know, the whole leg or part of the leg can swell up or arm puff up. You can have pain, particularly as the blood clot gets worse. It can go from a dull ache to intense pain. The skin can be warm as well. And you can have what's called pitting edema because you have fluid that's built up in the arm and the leg. And this can happen quite quickly with a blood clot. Now, if you have a blood clot to the lung, those symptoms are feeling shortness of breath, pain in your chest, you start to sweat, feel dizzy, cough. This is a true medical emergency. So again, I'm not trying to make you diagnosticians. I want you to be aware of this common complication from COVID-19. Practice prevention of COVID-19. And if your time is to get a shot in your arm, here is one more reason to prevent this complication from COVID-19, this hypercoagulable state. Again, not everybody gets it, but it is not rare, folks. Okay, this is Dr. Rhonda Johnson. My only intention is to help educate and inform you so that you can make the best decision for your health. My views are my own. Stay safe and stay connected. And as always, have a blessed day.